My Lords, the virtual proceedings on the private notice question will now commence. I will call the private notice question in the normal way. I will then call on the Minister to make the initial response. I will then call the Lord who asked the original question to ask her supplementary question in the usual way. The Minister will again respond, and I will then call in turn those Lords asking supplementary questions as listed on the Speaker's list. Please ensure questions and answers are short, and I apologise in advance if it's not possible for everyone to be called. Please ensure that you unmute your microphone prior to asking your supplementary question. Your microphone will be returned to mute when you finish speaking. In accordance with guidance agreed by the Procedure Committee, if your name is not listed, it is not possible to ask a supplementary question or take part in proceedings. Private notice question on COVID-19 deaths in care homes, Baroness Wheeler.
My Lords, I beg leave to ask the question standing in my name on the order paper.
Replying from the Minister, Lord Bethell.
My Lords, the need for daily figures means there are two official publications. The daily one, which is used in the number 10 presentation. This includes deaths of care home residents in hospitals, but not those who die in the home itself. And secondly, a weekly one by ONS covering all locations of death, including care homes, but has an 11 days lag.
Baroness Wheeler, supplementary question. Can you unmute your microphone, please?
I've done that. Okay.
Yep.
And sorry, right. I thank the Minister for his response. My Lords, both Care England and the National Care Forum report an alarming increase in the number of care home deaths, with estimates of over 6,000 deaths above this week's official ONS figures of 1,043, which we know are already 12 days out of date when they're published. The National Care Forum has called for the government to build a ring of steel around care homes to safeguard the most vulnerable among us, with providers suggesting doctors and nurses should be urgently deployed to fight COVID-19 in homes for older people. They've rightly stressed that an unprecedented situation calls for an unprecedented plan, as we've had in hospitals. What's the Minister's response to that?
Minister.
Noble Baroness is entirely right. This is an evil disease that strikes the elderly and those with pre-existing conditions the worst, and those who live in care homes are the most vulnerable. The government has sought to put a ring of steel in place. We've resourced care homes enormously. Testing is now being focused in care homes to try and reduce the prevalence of the disease, and we will continue to focus on protecting our care homes.
Baroness Andrews, supplementary question.
Thank you, Lord Speaker. Thank you, Minister. Can I ask you about the information we have on the deaths of care workers in care homes? And particularly given that so many of our care homes are staffed so extensively by BAME workers, and we are incredibly grateful for them. Can you tell us whether we are likely to have figures for the proportion of BAME staff in those homes who have died? And on that point, in the context of the review, which we welcome, into the disproportionate numbers of BAME workers generally in the health service who have been affected, can you tell us when that will start? Who will lead that inquiry, and what timetable will you be working to?
Minister.
I'd like to echo the Noble Baroness Andrews' quite timely comments on the role of BME workers, many of whom have provided an amazing service and put themselves in harm's way in order to care for those who are vulnerable. And the idea that they are being disproportionately hit by the disease is extremely distressing. The statistics and the numbers are not to hand. I cannot share with you precise numbers at the moment, but we are looking into this at speed and trying to understand both the causes and the impact of of this awful phenomenon, and I would like to commit to bringing those numbers to the House as soon as they are available.
Baroness Barker, supplementary question.
Thank you, Minister. I've heard about a care home where they lost a third of the residents in one weekend. It's that bad. I'm told that the Clipper system for ordering PPE isn't working, and consequently homes are having to try and source PPE by their own independent means. And of course, unlike the NHS, they have to pay VAT on those expensive items. That's going to push some who were already fairly vulnerable organisations over the edge, and they're going to close. So what's the government going to do to stop that?
Minister.
The noble Baroness is entirely right to raise the question of PPE. Looking into the medium and long term, there is undoubtedly going to be a massive demand for PPE in hospitals, in care homes, and in the wider workplace. That has put a dramatic pressure on global supplies. Britain, like every other country, is queuing for supplies of PPE. The government has thrown enormous resources at increasing supplies, and the Clipper system is one of the essential components of getting supplies into the workplace, and it's my belief that that is beginning to kick in and is working well.
Lord Bishop of Newcastle, supplementary question.
My lords, it's not just care homes facing these very serious challenges, but also I've learned hospices and sheltered accommodation, amongst other places. Managers responsible for these organisations are under enormous pressure, trying to ensure safe staffing levels and the safety of their staff. Hopefully sufficient PPE will soon be secured and distributed, although I recognise the enormous challenge and the efforts that are being made towards that. But in the immediate context where we don't have that, can the Noble Lord the Minister tell us how the government aims to advise and support those responsible for running our care homes, our sheltered accommodation and hospices, who are having to make such difficult decisions now, and many of whom feel abandoned and rather lonely in that responsibility?
Minister.
The Right Reverend and Noble Prelate makes a completely fair point. The disease is utterly unfair and cruel in the way that it targets the old and the vulnerable, and those who are in the front line of our care system are carrying the greatest burden of them all. Huge resources have been put in place, both financially and in terms of seeking to recruit more staff. Undoubtedly, more can be done. Guidelines evolve at great pace, both guidelines on PPE and also on other care arrangements. And we are constantly reviewing and updating both the arrangements and guidelines for care home staff, as she suggests.
Baroness Holly, supplementary question.
My lords, many people with a learning disability share their home with others with support from social care providers. If a housemate dies from COVID-19, this will be extremely upsetting. Also, many people were taken back to their family home, often by elderly parents from care settings at the beginning of lockdown. Some will have died there, or their elderly parent may have died, leaving them with no familiar support or advocacy. I'm concerned about the availability of skilled support to people with learning disabilities at such times of traumatic loss. There are accessible resources. I declare an interest as co-author of some developed by Books Beyond Words. Can the Noble Lord the Minister tell the House how local authorities are supporting providers and families to ensure that those receiving care are supported when somebody dies, especially given easements to the Care Act and the inability of family and friends to visit? Thank you.
Minister.
Noble Baroness raises what is probably the cruelest and most unkind aspect of this awful epidemic, and that is the circumstances of death, where those who love and care cannot necessarily be with those who have died, and cannot necessarily attend the funerals or mark the moment in the way that they would like. It is a cruel and horrible part of this epidemic. We have put considerable resources into support charities who provide care, and particularly around bereavement. If the Noble Baroness has any charities that she would like to recommend, could she please write to me, and I'd be glad to make sure that they have the resources that they need.
Baroness Jones of Maltcombe, supplementary question. No, we move on. Lord Laming, supplementary question.
Thank you very much indeed. The well-respected minister, I know, recognises that the department is the department not only of health, but the department of social care. I wonder if the minister would agree with me that there's been an almost total preoccupation in the department with the NHS and a near disregard of social care, resulting in a high price being paid by both individuals and communities. So does the minister agree that there would with great benefit be a fundamental review of the role of social care, the training and skills of the staff, and a proper regard accorded to those who daily are meeting the needs of the most vulnerable people in our society?
Minister?
The noble Lord Laming makes a point that I can't agree with, I'm afraid. Whilst the press may be more focused on hospitals, at the department we have put an enormous amount of focus on social care, and I pay tribute to my colleague Helen Whately, who is the social care minister, who does not allow us to spend 1 minute when we're not thinking about social care. But he is right that social care was deserving of a review in any case, and that this epidemic will make that review even more poignant, relevant and important. And I support very much his views that a review after the epidemic should take place, and it should be a root and branch look at the social care provisions of this country.
Lord Faulkner, I do apologise. I was slow on unmuting. May I come in now? It's Jenny Jane.
Well, I'm afraid no, we have reached 10 minutes.
Oh.
And I think we do need to finish it. We'll try to get you in on another occasion, Lady Jones. I want to thank everybody who came in, and I apologise for those who weren't able to ask a question. And as the Lord Speaker said in the earlier session today, that account will be taken aback when we have further sessions in the future. For the moment, the virtual proceedings are at an end, and I thank you all for your participation.